In Africa, we have had a lot of myths and beliefs about the baby's code. So how do we do code care? Ideally, the code will go away in time. Maybe between a week to 2 weeks, the code will be off. And don't be worried, the way you see even other mammals, the goats, the cows lose their code, you don't put in any science. The code will go away on its own. But eventually, if you don't take care of it well, it might fail to go away. So kindly make sure that the code is clean, aseptically, without putting anything like cow dung or whatsoever on your code. As you're cleaning the code, you start from inside and clean and then get outside. Otherwise, you will take organisms from out here and you put them in the baby's code. Hello everyone, I hope we are doing well. So today we are going to look at newborn care, or how do we take care of a newborn. So before I go to newborn care, I will first somewhere, I can never separate newborns from their mothers, and it would be unfair talk about newborn care without talking about how to care for a mother that has just given birth. So as a mother, after giving birth, you should not be stressed when you see milk not coming out. In the first 24 hours, you might have colostrum, which is little milk in particular, but it is enough for the baby. So don't be stressed. We have found that stressing our mothers as much. So the baby will fail, most especially the mothers that are delivering for the first time. So keep that in mind. The second thing will be kindly keep checking if there is blood coming out that is very much. So having a little blood that is coming is normal, but excessive bleeding results into a condition called PPH, and it might present with dizziness, loss of consciousness, weakness, and the rest. So kindly keep observing your pad to make sure that you don't have that excessive bleeding. If you've had a cesarean section, avoid applying what you don't understand on the incision site. This might cause sepsis and you might come back when your site is infected. Finally, as a mother, always make sure that your blood pressure and maybe your glucose levels are monitored after the delivery, because you might end up in eclampsia or preeclampsia even after delivery. All right, so we are going to look at care for the newborn. So we are supposed to be the ones, we are the eyes, we are the ears, we are the hands of these babies, because they cannot speak and they cannot talk. Even if they see, they cannot see very far. They see what is very close to their eyes and they cannot make personal decisions. So how do we take care of these newborns? One, we shall look at code care. In Africa, we have had a lot of myths and beliefs about the baby's code. So how do we do code care? Ideally, the code will go away in time. Maybe between a week to 2 weeks, the code will be off. And don't be worried, the way you see even other mammals, the goats, the cows lose their code, you don't put in any science. The code will go away on its own. But eventually, if you don't take care of it well, it might fail to go away. So kindly make sure that the cord is clean, aseptically, without putting anything like cow dung or whatsoever on your cord. As you're cleaning the cord, you start from inside and clean and then get outside. Otherwise, you will take organisms from out here and you put them in the baby's cord. Do not put anything, maybe antibiotic gels, that will protect the baby's cord. Always wash your hands clean before handling your baby. So that's part of the newborn care. And it's not the hands alone, even where the baby is going to breastfeed. Kindly make sure that the nipples and the mother's breasts are kept clean, and you always clean them before breastfeeding. How do we breastfeed? One, make sure that the baby's mouth covers the areola and there is no room for air to enter into the baby's mouth. That is very important for you. So the baby's mouth should be in position to cover everything. So that will protect the baby from maybe having aspirations while breastfeeding. And make sure that you support the baby's head to breastfeed well. If you cannot support the baby's head, allow the baby to sleep and you also sleep, to make sure that you elevate the head slightly and then you can breastfeed your baby very well. So how many times are you supposed to breastfeed? You are supposed to breastfeed your baby between 10 to 12 times per day. That is averagely every 2 to 3 hours, to make sure that your baby is breastfeeding. And as you're breastfeeding, make sure that you breastfeed the baby and you empty both breasts, because when there is still milk in one breast, prolactin will be inhibited and more milk won't be formed in the other breast. So kindly make sure that each breast gets empty at a time to make sure that more milk is being formed. Always observe for cracks on nipples and protect the nipples from cracks, because they are a source of infection, and maintain them very clean. We are supposed to breastfeed these babies exclusively without providing anything apart from drugs and prescribed supplements up to the period of 6 months. And at 6 months, you start introducing some nutrients, some extra food to this baby. That would be maybe another topic that we would discuss. So apart from breastfeeding, washing your hands, make sure that the baby is put in a bright environment during daytime to allow stimulation of the baby's senses and the brain to improve very fast. And then as the baby grows, make sure that the baby is given what to play with, such that we can stimulate growth of their brain. That is quite very, very important. So as we know how to take care of these babies, so we should keep them warm, not allowing them to be exposed to very cold environments, because they have a large surface area to volume ratio and they are at a very big risk of hypothermia. So apart from that, kindly observe for the danger signs in these babies, and those are quite very important. So it would have made no sense for us to leave this video without telling someone the danger signs that these babies are prone to having, or that show that this baby is not good. The very first danger sign that is common is fever in children. So fever is any temperature that is above 36.5 degrees Celsius for a baby, and it's a very dangerous danger sign. But apart from fever, even hypothermia, any temperatures Below 35.5 degrees Celsius for a baby are very low, and that's a very dangerous sign. So when you see fever, don't do self-medication. Did you know that we don't give paracetamol to babies below 3 months? So kindly don't do that self-medication. Run to a health service provider and they will make a personal decision, not you, to give these babies paracetamol because last time maybe you had a 1-year-old and they had fever and the doctor gave paracetamol. So kindly allow the doctors do their decision. The second danger sign is cyanosis. Or if you normally see your baby turning blue at times, most of the time they start from the face and maybe the hands and the extremities. Kindly, when you see that, that's very dangerous for your baby, run and bring the baby to a health service provider. The very third danger sign would be failure to breastfeed. If the baby refuses to breastfeed, kindly don't risk leaving the baby at home. They'll go into hypoglycemia, and that is a sign that the baby is not doing well. Bring the baby to health service providers for assistance. Apart from that, if the baby is crying excessively, that would be a sign that the baby is not doing well. Kindly bring the baby to health service providers very fast and they will improve. They will work on the baby very, very well. And then apart from that, if this baby starts oversleeping, your baby has always been active and now you see the baby sleeping all the time, the baby is not waking up, don't be very confident with that. Kindly make sure that this baby is brought to the attention of health workers and the baby is being helped out. Apart from that, the other danger signs would be lethargy. You see the baby is becoming flappy, the baby is becoming weaker, the eyes are not seeing well. Kindly bring the baby to a health service provider. And then finally, if the baby starts convulsing, having convulsions, those jerk movements, that would be an extreme and a very dangerous sign. Kindly make sure that you bring the baby to a health service provider. So those are part of the danger signs that you really need to know. And if the baby gets that, kindly send that baby or take that baby to a health service provider on time. Thank you so much as we are finishing up our maternal child health series as we had informed you prior. We thank you for following up. We thank you for watching every video. The next time we shall choose another topic that will come from you people. What you'll choose is what we teach. That's why we normally tell you to ask Dr. Star. All your questions will be answered. Reach out in the comment section and comment. Share the video to your loved ones. Don't keep your information alone. Thank you so much for tuning in. May God bless you.